Hello everyone, and welcome to another audio podcast as part of the Traadax Fissure. This is a audio podcast aligned to a Traadax Rupture, a Traadax Fissure in around another chartered edition and evidence-based perspective, and this is an audio podcast aligned to a Traadax Rupture and a sort of intermission as part of this, as part of a Storm Robotics, production. So in this overview, there'll be there'll be a basis around the importance of raising CKD awareness, chronic kidney disease awareness for young people for young people and for young people sort of suffering with CKD or chronic kidney disease, and also where in this overview we'll have a sort of a basis in around sort of the in around aspects pertaining to the specialty, and some aspects in around some aspects around the clinical medicine basis around this around sort of in around around the specialty as well. This works originally was collaborative, was a collaborative sort of from 2014, and where the works had been peer reviewed and published in the International Journal of User-Driven Healthcare in around 2014, and where collaborators were between an academic institution in the United Kingdom and also a social media platform. So in around this then, in around this. So So the pediatric nephrologist or the specialist needs to ensure they are providing best care with the understanding of what resources are available to service users, and the aims of this works, or this sort of collaborative works, was to highlight how sort of social media can influence care and shared decision making. And the claim in around this works was in around that future clinicians in around the pediatric specialty or pediatric nephrology are unable to develop sort of best practice unless they get sort of more involved in patient-led initiatives and better appreciate how young people with CKD, as and sort of service users, for example, utilize the internet and social media as an effective learning resource. So in around the pediatric nephrology specialty then, so pediatric nephrology brings a scope to collaborate amongst various organ specialties and sort of platforms of disease, different aspects of disease research in clinical and laboratory medicine, and with the intention of more science translating into mainstream practice. So in appreciating the care and in appreciating sort of the care for young people with CKD, pediatric nephrology, like many other pediatric specialties, has long implemented a clinical science ethos, and thus conventionally has maintained an academical research basis, owing to and primarily owing to clinicians seek to prompt 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 sort of those practices, clinical practices from laboratory from a laboratory basis, being translatable into sort of interventions or clinical sort of practices, or clinical sort of clinical sciences into sort of patient care. And so, whilst nephrology is specific in its own right, pediatric nephrology becomes more intricate at the same time, because of physicians caring for neonates or infants and adolescents with CKD, or chronic kidney disease, and works from sort of retrospectively, sort of 2000 in around 2005 had informed the future. The future will be the focus of pediatric nephrology training, and this was a direct quote from one of the citations in this collaborative works. And in around sort of the clinical medicine aspects, so clinical medicine is tends to be very hands-on form of medical practice, but to emphasize how rapid changes in methodologies take place. So, for example, if yesterday's protocols, for example, those in renal medicine that might be used to treat young people today, this could mean a subtle but significant difference between mortality, survival, and mobility tomorrow. The immune system in young patients will become, or can become, sort of compromised owing to infection, renal replacement therapies or RRTs, and a variety of other medical regimens. The physician or clinician needs to bear sort of a knowledge on entities in around the immune system, immunology, and inflammation. And the immunology discipline is active in around pediatric nephrology, and stress needs to be placed on disease on a disease basis, such as glomerulonephritis and hereditary or congenital sort of diseases. And strides have been made with regard to endeavors in around transplantation. In works by an author, one author in around 2007, in around 2007, an author highlights, for example, a plasmapheresis protocol is effective in removing both anti-AHLA and anti-ABO antibodies, and though not immediately used in young patients, but to be appreciated nonetheless. And the author in around 2007 also informed that this strategy may be useful for a small number of patients who have explored other sort of transplant options, for example, without success. In around works as well, the one author informs, for example, that other comorbidities or complications can become an increasing problem through, for example, hemodialysis, and improving post-transplant prognoses in young patients or young renal patients is becoming or has become increasingly important. The author in 2006 informs that specific comorbidities have remained. For example, the second most common cause of death in children or young people on chronic dialysis or are post-transplantation, accounting for approximately 20 to 25% of all deaths. And so, and there, in following, pediatric specialists or nephrologists will need to attain sort of a knowledge and comprehension in around, for example, in around sort of biomarkers and sort of in around endothelial function, which are now becoming sort of popular, have become popular medical themes. And in regard to biomarkers, one author informs sort of retrospectively that, for example, there are two in around sort of biomarkers from works by an author in sort of retrospectively in 2004. The author informs there are two forms biomarkers of exposure, which are used in risk prediction, and biomarkers of disease, which are used in screening and diagnosis and monitoring of disease. Uh, and in around works as well, in sort of in following particular concepts, the pediatric nephrologist will need to attain an understanding or have an understanding in the various modalities of identifying sort of endothelial and modalities in around identifying a sort of endothelial function, which has become which is and has been important. And in works by an author in 2009, the general principle of non-invasive evaluation of anatomy or physiology is based on, for example, ultrasound imaging of a particular arterial walls, or allowing measurement of intermediate thickness, and for functional studies of an in around elasticity as well. At the same time, clinicians are encouraged to possess sort of the necessary basis to keep up to practices in around their specialty by keeping up to date in around evidence-based practices. At the same time, in context of this sort of collaborative works, a little bit some aspects in around sort of pediatric pharmacotherapy. So research surrounding drug targets, formulations, and pharmacotherapy are important to understand for pediatric specialists. There is a sort of broad-ranging number of drug targets, including G-coupled protein receptors, enzymes, hormones and growth factors, ion channels, nuclear hormone receptors, and DNA. There are still drug targets that are unknown, and to be affirmed. It is to be affirmed that young people with CKD are generally under the category of sort of immunocompromised or immunosuppressed, and and activity is ongoing, can be ongoing issues or contentions. And so more evidence is coming forward, has been coming forward for the use of, for example, cytokines as drug targets for T cell tolerance post transplantation, for example. And best practice can only be achieved if specialists can relate treatment regimens through implementing pharmacotherapy based systematic reviews, critical appraisals, and meta-analyses, citations for comparisons in treatments. The entity should be upheld on in around pediatric care. There is now an increasing importance of raising CKD awareness for young people, young people and service users, and this can only happen if there are more sort of focus or service user focus dimensions accordingly. So in around patient focused dimensions, traditionally specialists tend to have a preset aptitude and distinctions that potentially illuminate the academic integrity within them. But now this is not always the case. So what issues are pediatric nephrologists sort of facing? So pediatric consultants need to comprehend essence around again sort of clinical science, laboratory practices, clinical epidemiology, epigenetics, patient-led initiatives, and in around medical statistics, to name a few aspects. So in order to one thrive and succeed in the specialty, and two to place them more as holistic sort of physicians, as holistic physicians accordingly. So having an overall understanding of where to bridge sort of gaps in healthcare will and should allow pediatric nephrologists to sort of better comprehend translational science, especially with regard to endeavors in bettering renal replacement therapy, RRT regimens, best immunosuppression protocols for young people, patient-led initiatives, transplantation, allograft prognoses of survival, and genetic renal diseases. So indeed, physicians who are actively involved in, for example, continuous professional development, are to be and should be commended. Epidemiology and statistics are subject areas becoming increasingly important in everyday nephrology. Thus appreciating attaining knowledge at population level, inform of CKD young people. Um, uh, 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 sorry. Epidemiology and statistics are subjects areas are subject areas are becoming increasingly important in everyday nephrology. And so in works from sort of in retrospectively as well in sort of 2007, an author informs in around a global perspective. Additional efforts to define the epidemiology of pediatric chronic kidney disease worldwide are necessary if a better understanding of the full extent of the problem areas for study and potential impact of intervention is desired. So clinicians need to know. So in around this, clinicians need to know how to gain sort of access to journals and specific software that will enable them to attain knowledge sort of at their fingertips. And in a related note, software that holds sort of large that holds sort of data sets and genetic information, and retrieving this data will become important in around analyses of potentially rare renal anomalies, and in appreciating the concepts of for example, concepts in around single nucleotide polymorphisms as well. Clinicians thus need to have an appreciation of what it means, at the same time of what it means to cope and deal with a chronic illness. This then goes into the sort of the next and the following aspects. Uh, in around the following aspects. So coping has been described as a strategy by several authors, sort of retrospectively, and coping is a precursor to psychological growth and lessening anxiety. In works sort of retrospectively in 2000 from 2008 and in 2008, an author informs coping specifically in relation to young people, in relation to young people, that coping represents thoughts, feelings, and actions that an individual uses to deal with problematic situations encountered in everyday life and in particular circumstances. In works in 2003, retrospectively, an author informs that people use a sort of caravan of resources, and resources that people gather through life, that can be taken with them. And support resources come from, for example, from learning and connectedness, and in around networks. If the environmental load substantially exceeds an individual person's resources, then a stressful situation exists. Information is one such resource utilized as support in as part of a coping process, and acknowledges the complexity of the coping situations in around young people. In works in 2013, authors had identified a sort of an association, if you like, between information and ability for young people to cope with particular long-term conditions following an information coping trajectory, becoming becoming sort of becoming what had been referred to as information donors, and sharing knowledge and supporting others through work, information groups, and through the internet. The duration of transition from teenage years to adult is known to be a particular is known to be particularly challenging for young people, and works retrospectively inform and identify the critically or that identify the criticality of communicating information effectively and appropriately to help people cope with illness, and with sensitivity needed in around aspects of communication, and particularly in around healthcare communication. Information and communication in the healthcare context forms a complex network in which there can be tensions due to the lack of information, and misinformation, misunderstanding, or mistrust. And um, and uh, there's works retrospectively, or also have examples of contradictions or dilemmas where for advice and support may be viewed by the reviewer sorry by a receiver as either helpful in context of a positive experience, or butting in, for example, as a negative one. Young people experience a range of emotions when living with ill health, including barriers to effective communication, coping, fear, and uncertainty. Works retrospectively also in 1998 had identified that communicating information about illness as a form of support can reduce uncertainty and help people cope. Works in 1999 in authors by in 1999 inform that work on in communication identifies the importance of understanding and the management of uncertainty in a health context, in a health context where in some instances people want to reduce uncertainty because it is threatening, and other times uncertainty allows people to have hope. Uncertainty also prompts or propagates some to have hope, and where some remain and some where evidence informs, some can be optimistic in times of uncertainty. In 2003, one author informs that young people's maturity and their preferences for in around communication and complex, showing contradictions, tensions, and in some cases binary oppositions. So, for example, doctor as hero or doctor as a villain. Informed contradiction also occur when individuals have different constructions of the constructs in around the situation of phenomena, understanding or perceiving things differently, and this can lead to misunderstandings. In works by in works sort of in works sort of in retrospectively as well in the mid 1980s, works had informed works and informed by authors who studied emotion and coping with young people, identified three main themes. Number one, the stressful encounter is dynamic and unfolding. Number two, people experience contradictory states of minds and emotions. And three, people cope in complex ways. In works in 2010, um, in 2010, and one author highlights that a theoretical framework to explain information exchange in the healthcare context, specifically with young people, has been required and there is where the author highlights a model a basis this identifies both positive and negative influences of information and knowledge exchange in clinical context during sort of transitioning years between ages 13 to 19, in context of transitioning from pediatric services to adult care, often where the information support exchanges in the clinical context are negative or lacking in some way. Young people seek support from support mechanisms in around networks, in around sort of different networks, and increasingly this extends beyond sort of friends and family extends into aspects of social media and the internet. Now, at the same time, this collaborative works informs that that the need for the need for not just trustworthy but accessible information for young people is important, and also where an author had informed a an important aspect within young people for an important aspect for young people or in around young people is ability to approach aspects around health or healthcare, and therefore where information and resources accessed should be appropriately sort of appropriately accessible, and at the same time in this collaborative works, authors had identified and highlighted that it would be more advantageous to conduct more action based research with the aim of understanding how health professionals or service providers implement care for young people implement care for young people in around particular health conditions, and where the example again in around this is chronic kidney disease, CKD. In addition to understanding the sort of coping strategies they utilize, and how the internet and social media and how social media help or support them, and we're coping and gathering sort of resources is concerned. The In this collaborative works from 2014, and from 2014 a particular example is highlighted in this a particular example is evidenced in this collaborative works in around where one example, a particular resource in context of social media has proved a resourceful has proved resourceful between sort of young people and also adults in context of chronic kidney disease, in around chronic kidney disease, or CKD. So uh, in this collaborative works as well, there is sort of an overview in around two social media platforms, one being the RPSG, and the other being KDAS. And so in around some sort of in some sort of concluding aspects around this particular audio podcast around this Traadax fissure. So the claim here is that future clinicians are unable to sort of best practice unless they become more involved in patient-led initiatives, and better appreciate how patients use the internet as an effective learning resource. And so this collaborative works informs how sort of social media can help raise particular disease awareness, providing examples, and where there are still ongoing challenges to provide sort of care for those with CKD, and ultimately there is an increasing requirement or need to again sort of raise CKD awareness, and sort of see that young people sort of enhance on coping strategies, and highlight how and where there's a basis in around highlighting how the internet and online forums and social media platforms can be resourceful. So as per the claim, future clinicians in around pediatric in around this particular pediatric specialty, pediatric nephrology, are unable to again sort of develop in around best practices unless they get are involved in sort of more patient-led initiatives, and also where professionals should have an understanding of what resources are available to service users. Studies are required to understand whether the internet or internet use under supervision for example, service providers will improve clinical outcomes, adherence, and adherence and coping strategies and decision making in service users, and these are required in order to achieve to achieve best practices for the care of young people for the young people in CKD. So that draws this audio podcast, this Traadax Fissure, to a close. This has been a Traadax Rupture. There will be a list of a sort of list of resources, citations as part of this audio podcast on social media, so listeners can check out the information, can check out the citations in around similar works in around similar works as part of this audio podcast on social media. So again, this has been audio podcast around an intermission around the Traadax Fissure, a Storm Robotics production, a Traadax Rupture, a chartered edition, and evidence-based perspective. Thank you for tuning in.